Hey YouTube, how you guys doing? I hope you guys are doing well. And anyway, this video is gonna be on long-term care orientation. So if you just started a new job or you're gonna start a new job in long-term care, I'm just gonna be telling you things to know and things to locate inside the building. Um, and that's basically it. So let's get into it. Okay, so the first thing that I think you should do, that I would suggest, would be to have an index card in your pocket, wherever. And as you're going through the building, if it's a secure building, it's gonna have codes on all the doors. So write down all your codes so that you can move around the building without being slowed down by not knowing a code, because once you don't know code, you got to go find somebody and they have to give it to you. So that's just unnecessary. So know all the codes, have that on the index card. The other thing you need to memorize in orientation is certain phone extensions. So one you would need would be physical therapy. If you can't find your patient, 9 times out of 10 they're going to be in physical therapy. Um, you need to know laundry's extension, because in long-term care, this is where these patients live. So they need their laundry done. Sometimes they run out of clothes, or sometimes their family will buy them clothes, and those clothes need to be labeled. So you need to be able to call laundry real quick and ask them to do that. Also, you need dietary's number. Obviously, somebody might not like their food, so you need to order them something else. Social services. You'll need them if somebody asks you something pertaining to a discharge, or say they need housing after to or maybe it's something that has to do with getting a job or something like that pertaining to after their discharge, or even home care. That's social services. um so know their number. And then one that you might not think of would be financial the financial person in the building, like who is handling the patient's money. um I think on the first of the month or something, they'll get a certain amount of money. So when that runs out, they'll want more money. So you need to be able to just call that person and tell them so and so wants their money, and that's it. You're done. So just know those numbers: physical therapy, laundry, dietary, social services, and then the person with the money, financial. Um, so things to locate and know where they're at on orientation would be the med room, obviously. What's going to be in the med room? Familiarize yourself with the med room. If there's something that's not there and stocked in the med room, where is the supply room? And are you allowed to go to the supply room, or does the supervisor have to go? What's the procedure with that? And then inside the med room, there should be an e-box. And it's a box from pharmacy with a bunch of emergency medications. So locate that. It'll have Narcan. It'll have IM glucagon. It'll have vitamin K, epinephrine, anything you need in an emergency in it. And ours even has psychiatric medications for injections, which I've never seen used, but it's there. So locate this box, and if you don't have one, ask, well, what am I doing in an emergency? You know what I mean? Where am I getting that IM glucagon when my diabetic's blood sugar is 40 and they need it stat? So ask all them questions now, not when the emergency happens. And by now I mean in orientation. What else? In the case of a code, where's your AED at? It's not going to be on every floor all the time. Like, it might be on a certain floor. So just figure out where is the AED. Of course, where's the crash cart? That should be obvious. Also, where is the Pyxis? Might not happen when you're on orientation. So just know where the Pyxis is in case you run out of medication, and make sure you have your password to get into the Pyxis. Also, who are you calling after hours for emergencies? Are you calling like an on-call service via phone, or are you using a tablet, like where you're calling the physician with the tablet? Like, sometimes it'll be like that, where it's a certain tablet and it's only for that on-call physician. That's how it is in my facility anyway. And then before we had that, it was a phone service. You just call, say I need to talk to the doctor, and the doctor will call you back within like a half hour. But if it's an emergency, they call back faster. So who are you calling after hours? Don't call your in-house doctor after hours on their cell phone, because that is a good way to get on their bad side, like, right away. So don't do that. Also, just if your facility is a smoking facility, anywhere, the patient should be smoking in one specific area, okay? And if they're in that area, somewhere in the vicinity should be a fire blanket in case someone were to catch on fire. I've never heard of that happening. It's never happened at my facility, but it could. So locate that fire blanket in case that happens. Then you have something to use if you happen to be there. But it's just something to look for. You never know. And if it's not there, then that facility is not up to code. So that's basically it. Let me make sure I didn't forget anything. I don't think so. So if you guys watched this long, thank you so much. If you have any questions or want to see some other kind of topic, let me know. And if you did watch this long, leave me a smiley face or something in the comments. Like, I would like that. Anyway, what was the other thing I was gonna say? Oh yeah, I'm in microbiology right now, and I was thinking about doing videos on school too. So just for you guys who are doing your prerequisites as well. So I'm gonna do a video on lab and micro, and just give y'all a couple tips that would help you out. Okay, so like, comment, subscribe. I would appreciate it, and that is it. Bye.